Good evening, one and all. I'm Karan Sharma, and on behalf of FDC, the makers of Vitcofor, I welcome you all to the 15th episode of our Sunday 9 p.m. show of Iron Talks. Here on Iron Talks, we discuss anemia and how it could affect the different organs of the body. Well, not just the body, we have also been fortunate enough to have speakers from across the country. On this platform, we have had learned scholars from different specialities and super specialities as well of medicine to speak and share their knowledge as well as experience on how to approach your patients if they have any chronic or acute disorders along with the presence of any underlying condition we so commonly refer to as anemia. Similarly, our topic for tonight is diet and anemia, and we have tonight with us a speaker and experienced senior consulting dietitian from Mumbai to speak on this interesting topic. So, before we have our speaker amongst us, let me call upon stage the expert himself, whose never ending efforts and consistent efforts have made our Sunday 9 p.m. show our very friendly, our very own Iron Talks, the show what it has become today. A doctor of medicine, a senior endocrinologist from the northern part of country who has completed his DM endocrinology from the very prestigious institute New Delhi, a fabulous person to know in person, Dr. Sanjay Kalra. Good evening, sir. And on
Good
behalf
evening,
of our
Ken.
audience tonight, I welcome you on this stage once again, sir. Sir, I have a small doubt, but before we come to that, how are you, sir?
All fine. And what's the doubt, Karan? Now I'm
Sir,
curious.
right, sir. Sir, we have been having so many interesting topics on this platform. But, sir, when it comes to anemia, it's a cycle. If improper or unbalanced diet could definitely lead to anemia. Anemia could further lead to fatigue, breathlessness, and many other signs and symptoms. But most importantly, it could further lead to loss of appetite, which could further lead to more aggressive anemia. If it is not intervened and left untreated, this cycle could continue and could lead to a very unbalanced state of well-being. Is this correct, sir?
That is correct. So, poor diet can cause anemia, and anemia, like you have rightly mentioned, can lead to poor nutrition. And this
Right.
vicious cycle is something we have to come out of. So, when we speak of treatment, that is separate. But we should be speaking about primordial prevention, primary prevention, so that nobody becomes anemic in the first place.
Right. So, exactly, sir. So, welcome on the stage, sir. The stage is all yours.
Thank you, Karan. A really important point which you have raised today, and that is why we have one of our country's best experts today to talk to us about anemia and nutrition. Warm welcome to Shilpa Joshi ji. Madam is a registered dietitian, one of India's leading voices, most respected voices in the field of diabetes, metabolic syndrome, and healthy nutrition. She practices at Mumbai. She is also a known figure in digital therapeutics or digital nutrition. So not only does she give consultation for nutrition at her own center in New Delhi, in Mumbai, she also consults and teaches people to to offer healthy nutrition through the digital medium. So warm welcome, Shilpa ji. How are
Thank you
you
so
doing
much.
today?
I'm good, sir. Thank you so much.
We have this wonderful audience from across the country. It is physicians, and greetings to you from Nitin Rulaji and also Dr. Anshul Singhai from Bhilai, Chhattisgarh. And everybody is curious to know what is the role that nutrition can play in anemia. Till now, we had thought that all we can give is either oral iron or intravenous iron, and that's all we've been talking about for the past 3 months. Is there anything else simpler, stronger, more sustainable that we can do to prevent and manage anemia?
So, should I share or we are going to
Yes.
discuss it?
Your slides, please, and then lots and lots of questions already coming up for
Yes.
you.
Yes, sir. So, thank you, sir, so much. And like sir said, we are going to discuss on diet and anemia. And something which sir alluded to right in beginning, and also Mr. Karan alluded to that, it's a vicious cycle. Because you have anemia, you have loss of appetite. And because you have loss of appetite, you have anemia. And beyond that, there are a lot of preconceived notions about what is iron rich. And that is what I am going to allude to today. So this is anemia. We know the definition is, is a condition where there are lower number of red blood cells or hemoglobin concentration as compared to normal. And hemoglobin, we as know, is required to carry oxygen across the body, and therefore hemoglobin or iron in red blood cells is important. Now we also know that there are many types of anemia. What we are going to talk today is more specifically nutritional anemia or iron deficiency anemia. Iron deficiency anemia is most common type of anemia, and it occurs when dietary intake or absorption of iron is insufficient and hemoglobin which contains iron cannot be formed. So this is the kind of anemia we are going to talk. Besides that, there is sickle cell, thalassemia, megaloblastic anemia, pernicious anemia, aplastic anemia, and pure red cell anemia, but we are not going to discuss that. Now, before we come to when we come to iron deficiency anemia, I think the most important part which is spoken here is dietary iron. So, if you're not going to eat dietary iron, you realize that the stores of hemoglobin are lower, and therefore dietary iron becomes a very, very important component in management. So, there are two kinds of dietary ions. There is heme iron, and then there is non-heme iron. Now, heme iron is found only in hemoglobin or myoglobin, which is derived from meat, poultry, and fish. So it is called as MPF, meat, poultry, and fish, because meat, poultry, and fish will have a lot of myoglobin in their muscle, and therefore this kind of iron is highly bioavailable. So it is absorbed up to 30% in human body. As compared to that, non-heme iron is present in present in plant products. It is affected by other nutrients, and that it ranges from 1 to 10%. Majority of iron in omnivorous diet is non-heme iron. So if you look at our Indian diets, most of our iron which comes in our diet is from the non-heme sources. So we are looking at green leafy vegetables, we are looking at certain cereals and pulses to give us iron, but their majority of them are non-heme in their sources. So like we know, so non-heme iron exists as ferric, okay, which has to be reduced to ferrous prior to uptake by duodenal epithelium. All ionic iron salts have similar mechanism of absorption, whereas heme iron, because it comes from animal products, it is directly taken up into the intestinal epithelial cells. So this is the whole iron transport mechanism, where you are seeing that iron has to get reduced and then absorbed, especially if it is coming from the non-heme sources like Fe3. It has to become Fe2 and then get absorbed. Okay, so this is the factors which influence iron absorption. Heme iron is highly absorbed, then Fe2, and then Fe3. Now, what are the inhibitors of iron absorption? The most common inhibitor of iron absorption is phytate. Now, phytates are actually phosphorus groups which are present. So, phytates are very, very rampant in plant life, because you know ATP, which has the phosphate group in it. So, phytates are there as source of energy, and they are rampant. So, phytates, tannins, which are present in teas and coffees. So, typically people have this habit that in nashta they will have a cup of chai with the khana, or after food lot of people prefer a cup of tea. These kind of things actually inhibit absorption of iron. Antacids, overtake of antacids, and also proton pump inhibitors, which decrease the acidic medium in the stomach, will cause decreased absorption of iron. Calcium is a potent inhibitor of iron absorption. So certain recipes, this is something I wanted to allude to. The most commonly eaten recipe, palak paneer. So palak is a source of iron, though not a rich source, but nevertheless source of iron. And then you are adding paneer, which is source of calcium. Then the iron from the palak will not be absorbed. Other transition metals like zinc, copper, iron overload, etc. So, like I said, antacid and proton pump inhibitors will actually cause, decreased absorption of iron. Then there are other competitors, other metals like lead, cobalt, strontium, magnesium, zinc. So, for example, if somebody is continuously taking a lot of oral zinc, then this will get absorption of iron will get influence. Facilitators are gastric acid. So, good acid pH in the stomach is important for iron absorption. Calcium citrate, ascorbate, that is vitamin C, amino acids, and I'm going to come to this in detail later on, and other dietary factors such as meat, fish, poultry are actually facilitators of iron absorption. Okay, so influences in dietary iron bioavailability. Several factors influence the bioavailability of dietary iron. The rate of absorption depends upon the iron status of the individual as reflected in the level of iron status. Lower the iron stores, greater will be the absorption. Individuals with iron deficiency anemia absorb 20 to 30% of dietary iron compared to 5 to 10%, which is absorbed in individuals that do not have iron deficiency. Then there is a difference between bioavailability of types of dietary iron. So absorption is also influenced by form of iron in the diet. So heme iron, like I said before, which is present in meat, fish, and poultry, is much better absorbed than non-heme iron, which can be found also in meat, fish, and poultry, as well as in eggs, grains, vegetables, and other fruits. Okay, iron absorption rate of non-heme iron varies between 3% to 8% depending upon presence of certain enhancing factors, but more specifically ascorbic acid and meat, fish, poultry. What does that mean? If you're taking iron rich food and if you're putting ascorbic acid in it or vitamin C containing food, the absorption from 3% can go towards 8%, so somewhere between 5%, 6%. Also, a lot of times meat, fish, and poultry which is eaten with non-heme iron. So, for example, somebody is eating a non-vegetarian food with a vegetarian food, which is sort of green leafy vegetable, a rich source, then the iron in that green leafy vegetable is better absorbed in presence of meat, fish, and poultry. So, ascorbic acid we know is a powerful reducing agent and it binds to form a readily absorbable iron complex. Meat, fish, and poultry will also potentiate non-heme iron absorption. Okay, now, meat, fish, and poultry digestion may lead to release of certain amino acids, and these amino acids are particularly cysteine and polypeptides in the small upper bowl, which chelate with non-heme iron to form soluble absorbable iron complexes, and hence presence of protein, particularly cysteine. So it is not necessarily that you have to have meat, fish, and poultry, but you also get a lot of readily available protein products which are rich in cysteine or other smaller polypeptides which can actually help in iron bioavailability. So this I'm talking, and I'm going to allude to this in slides later, but because dietitians are big fans of protein, and we realize that in Indian diet, when somebody gets anemia, you concentrate a lot on giving them iron, but we never look at what is the amount of protein in the diet, because ultimately hemoglobin is a complex of heme and globin. So heme is iron, globin is a protein, but nobody's actually bothered about how much protein is present in the diet, and that's where this becomes important. Which are the inhibitors of non-heme iron? So iron absorption can be inhibited to varying degrees by number of factors that chelate iron, including carbonates. So carbonates are coming from these Cokes and Pepsis and other things that you can typically soft drinks which are taken in with the main meals. Oxalates naturally are found in lot of green leafy vegetables. Phytates are also found, and phosphates again come from carbonated beverages. So factors in vegetable fiber, so very fibrous products, if they are eaten, they can also inhibit absorption of non-heme iron. And very surprisingly, all rich non-heme iron sources like green leafy vegetables or certain millets are also very rich source of fiber. And hence, although these products on textbook are very rich sources of iron, their bioavailability is slightly poor. Taken with meals, tea can reduce absorption of iron by 50% through formation of insoluble iron compounds with tannin. EDTA, which is added to as a food preservatives, can cause a 50% reduction in non-heme iron absorption. Iron in the yolk is poorly absorbed because of presence of phosphatine. So iron, egg yolk has a natural compound which is called as phosphatine, which will bind the iron and not let it get absorbed. So these are natural inhibitors of iron absorption. So how to increase iron in food? Improve food choices through dietary iron intake. Include a source of vitamin C in every meal. So a nimbu, a tomato, this is the season of avla, so avla, something in every meal every time you eat. If you are a meat eater, a non-vegetarian person, include meat, fish, and poultry in every meal if possible. If not possible, try to consume some kind of protein source which is coming from not from things which do not have calcium in it. Avoid drinking large amounts of tea and coffee with meals as they both contain tannin. Avoid high quantity of EDTA by checking the food labels. Reduce the milk consumption to no more than 3 cups a day and replace it with iron rich, foods which are rich in iron. Okay, so these are dietary strategies, so you have to eat these foods. So increase intake with nuts, beans, vegetables, fortified grains, and do not consume these kinds of products. So these are certain iron containing foods. So if you look among cereals, there are only three cereals which are rich in iron. First is amaranth, which is also called as rajgira. Then there is bajra, and then there is ragi. Then there are pulses. These are lot of, and rajma, for example, red rajma or horse gram or masoor. These are rich sources of iron. In vegetable, remember spinach is not a rich source of iron. Red amaranth, methi, and gogu have more iron than in spinach. In fact, coriander has more iron than spinach. And if you notice here, there is no mention of beetroot. So remember, beetroot is not a source of iron. Beetroot does not even have zero point 0.1 milligram of iron. The red color of beetroot is because of anthocyanin, a pigment in it, and not because of iron. Then fruits, dates and dry dates are rich source. Seeds are very, very rich source of iron. So sesame seeds, garden cress seeds, and Niger seeds. Niger seeds is kalonji. Garden cress seeds is called halim, and sesame seed is til. And then non-vegetarian, of course, all foods are rich sources of iron. Now I'm going to talk about something very interesting: management of iron deficiency anemia beyond iron. So we all go crazy talking about iron, and it is very relevant that for iron deficiency anemia, iron has to be taken. But low protein intake also has a risk of anemia, and there is enough and more scientific evidence to show. So, like Mr. Karan was saying right in beginning, malnutrition actually turns the cycle on, of anemia. So malnutrition, either due to inadequate intake or due to disease, and one leading to another, will cause, these kind of problems. And therefore, it is very important that we tackle it in time. So, protein for iron absorption. So, protein is considered as a key factor required for iron absorption, along with other known factors or like vitamin C. So, it's very, very important that they take. And this is again, it was published in the ESPEN Journal of Clinical Nutrition, that protein energy malnutrition increases risk of infection, impairs cognitive function, motor coordination, leads to anemia, sarcopenia, bone loss, which is associated with increased morbidity, which is following infection. Malnutrition and low protein diet compared with control diet showed a decreased RBC and hemoglobin and reticulocytopenia and severe bone marrow and splenic atrophy. So it is very, very important to understand that protein is required. Protein will also enhance absorption of iron, make it more bioavailable. So please concentrate on protein intake as far as anemias are concerned. Give iron. Iron is very, very important, but so is protein. Do not give protein a stepmotherly treatment as far as a prescription for somebody with iron deficiency anemia is concerned. So there are various studies to show that majority of school children consumed inadequate amounts of pulses, green leafy vegetables with protein containing food, and therefore that led to a lot of deficiency in nutrient intake like energy, protein, vitamin, and other minerals, and riboflavin, iron, and folic acid. Most of them had anthropometric measurements significantly lower than reference value. Major reported nutritional problem are protein energy malnutrition, vitamin A deficiency, and iron deficiency anemia. This is a huge problem. Again, there is more to show that there are low recommendations that one needs to take adequate food intake and combat protein energy malnutrition when you are treating iron deficiency anemia. So, caloric and protein restriction also causes nutritional anemia. Protein and energy malnutrition increases cytokine production, leading to inflammation, immunodeficiency, and anemia. Malnutrition with low protein diet decreases RBC and hemoglobin level and may cause reticulocytopenia, severe bone marrow, and splenic atrophy. So, adequate protein intake, at least of a gram per kg body weight, is what is recommended. Okay, so again, these are just studies to show that vegetarians with inadequate protein intake. So there are two kinds of vegetarians. Also, there are just two kinds of people. Even though they consume non-vegetarian food, they can still have protein deficiencies or intake is inadequate. Vegetarians are more at risk of inadequate protein because the sources of vegetarian protein are typically dals, and people don't like dals as much. So vegetarians with inadequate protein intake are 5.52% times more likely to develop anemia, and this should be taken into consideration. Where also because they have less heme iron in their diet, but you can have a lot of non-heme iron coming from other sources, but if you don't have protein to supplement it, it's not going to work. So again, it has been shown that non-vegetarians do tend to consume more protein than vegetarians, but you will also see that anemia is less prevalent. Hemoglobin levels are better in people who consume non-vegetarian food, not just because of no, heme iron, also because their protein intake is way higher than vegetarian. Does not mean that I am advocating that everybody turn non-vegetarian. All I'm advocating is please eat protein to have near normal hemoglobin values along with iron. So, several studies have shown that protein deficiency is associated with inadequate hemoglobin synthesis, and therefore, essential amino acid supplementation also improves hemoglobin and albumin levels. Other than that, there are other micronutrients in erythropoiesis which are required: iron for hemoglobin formation, cobalamin. Again, B12 deficiency is something which is rampant in our country because it is a cofactor for amino acid synthesis, TCA cycle, and it facilitates maturation and differentiation of erythroid lineage. Folate, of course, folate is known also. Folate is rampantly present in nature. So if you're eating carrots, papaya, tomatoes, you are going to get folate in some form or the other. But B12 is really difficult to find as far as vegetarian diets are concerned because there are no dietary sources of cobalamin in a vegetarian diet. Then copper, a key regulator of iron transport from intestine and release from cell into circulation. So again, copper is important. Zinc, again, cofactor for protein synthesis and regulator for cell differentiation. Manganese, selenium, and pyridoxine. So pyridoxine is also important. So remember, it is not just about iron. It is about these all nutrients which are important for formation of hemoglobin or for iron deficiency anemia. So these are nutritional guidelines. Just last two slides. Eat right in small meals and to help better absorption and digestion. Include protein rich food in each meal. So don't wait for lunch and dinner to eat protein. Eat protein adequately through the day. Okay, to further enhance iron absorption, eat vitamin C containing foods like amla, guava, berries, melon, mango, pineapple, citrus fruits, etc. Limit intake of teas and coffees with your meal. They are not good. Do not combine iron rich meals with too many calcium rich foods like milk, cheese, paneer, etc. Avoid highly refined and processed food like pasta, noodles, polished rice, ready to eat foods, etc. The reason being that they are refined to an extent that you are losing out non-heme iron from them. Knowingly add iron rich foods to your diet. So this is the list of iron rich foods in your diets. Okay, you have these. Then include food sources of B12 if you are a non-vegetarian. If you are a vegetarian, see to it that you supplement yourself with good amount of vitamin B12. Add dietary sources of folic acids, easily found. Anything which is red, orange, yellow in color in nature will have a lot of folic acid. So, India accounts for largest number of anemia cases in the world. Iron and folic acid, B12 supplementation is the main player for managing iron deficiency anemia. However, prevalence of anemia is continuously rising in India despite of long history of policy commitments and programs, and therefore there might be certain factors which are important beyond just iron supplementation. What we see is protein restriction also causes nutritional anemia. Higher protein intake, better is iron absorption, lesser will be iron dosing required. Protein supplementation turns out to be beneficial in increasing hemoglobin, RBC count, and hematocrit, and multiple micronutrient supplementation are also beneficial in improving hemoglobin levels. Thank you so much for patient hearing, and I'll be happy to take any questions that you have.
Thank you, Shilpaji. A great exposition and so many new things that I have learned, and so many myths and misconceptions that you have broken. But like an iron lady, what you have been able to put forward very clearly is that we need to take care of our diet, and this comprehensive approach, not only iron, but the other things as well, like you spoke about protein. So the message about a balanced diet, a complete diet, that is well taken. We have many questions, and there is one question from Dr. Nitin Narula, who asks about nutraceuticals or functional foods that we can use to cure sluggish blood circulation in winter.
So I think the kind of foods that you need for winter are foods which are very thermogenic, also in nature, to feel better. And traditionally these foods are eaten. So when come winter, people advise you to eat a lot of nuts and seeds since time memorial. It's not that it's today. So these are things which also are rich source of iron, rich source of essential fats, and very very good source of protein. So try to include a handful of nuts and at least 2 to 3 tablespoons of seeds every day. Now, which are these seeds? So, like I said, garden cress seeds. I mean, in Bombay, we call it halim. It looks like sesame. It's chocolate brown in color. It is the richest source of dietary iron. 1 gram contains 1 milligram iron. So it's that rich. Nothing is as rich as that. So if you can have these kind of seeds, or you can have sesame seeds, इसीलिए संक्रांति पे तिल के लड्डू खाते हैं ना ठंड में. So they give you a lot of thermogenesis. So these kinds of things, and of course then your almonds and walnuts and other things which you can eat to give you better thermogenesis.
So sesame seeds, that is til ke beej, and halim seeds.
Halim
These are
seeds.
two good sources.
Yeah.
And like you said, nuts and seeds. And let's
Yes.
ask the audience, can you find out the Hindi for Halim? Though, of course, Halim also seems to be Urdu.
No,
But
Halim is Hindi. It's called Aliv
Halim is
in
Hindi.
Marathi. So Halim is definitely Hindi, but I
Halim
think
is
Hindi
Hindi.
also changes state-wise, right? So
Yes.
I am not really sure.
So Halim seeds, and also sesame seeds, which is til ke
Yeah.
beej.
Till,
And of course,
yeah.
the English is garden cress seeds, like you said. So I'll try that out this winter actually, and let us see how we can use it in various recipes. But like for vitamin C, we say that if you boil it, then it gets denatured. Is that true for
Yes.
iron as well?
No. Iron, it doesn't. But vitamin C is highly temperature. Actually, it's even photosensitive. सो बहुत लोग वो आंवला काट करके वो धूप में सुखा करके फिर खाते हैं. So you have lost all the vitamin C in it because you have exposed it to sun, heat, everything. So this is a season to eat amlas. Because amlas are in season now. Amrud is in season now. It's a season of guava. So all vitamin C rich fruits actually are there in season. And I would highly encourage उसको काटो और तुरंत खाओ, और काटो भी मत, चबा के खाते आया. So even that's better because you're less exposing it to oxygen, to light, everything. So it's a good. So don't make juices. वो आमले का जूस पीने में कोई मतलब नहीं है. आमला तोड़ो और वैसे ही खाओ. That's what you need.
खट्टा होता है थोड़ा सा. It can be
हाँ,
a
पर
bit.
सर इट्स द आयरन की टैबलेट भी कोई बड़ी अच्छी नहीं होती.
अच्छी नहीं होती. Point. You are right. And Dr. Anand Purandare says, "Ma'am, if I cook in iron utensils instead of stainless steel utensils, will that help in iron supplementation?"
So it does, but really we do not know what is the bioavailability, because you see that ferrous, the bioavailability is different, and that transformation within our body is different. So while cooking in iron, net iron of the food increases. Is that net iron bioavailable? Is a very big question. And we really do not know how much is the bioavailability just by cooking things in the iron pot. If you go send that food cooked in the iron kadai for testing in a lab, you will get very high iron. But will that ensure that you are going to get cured of anemia? We really don't.
We don't know. Though there is something known as the biopsychosocial model of health. And when you look at nutrition or you look at nutritional diseases, these are not limited to the individual. They are an issue for the family, for society.
Correct.
Now, you imagine a patient who is coming to you in the clinic. All people are doctors here, the ones who are logged in. So, uh, you talk about your diagnosis, which is anemia. You explain the etiology, which is usually nutritional, 99% of the times. And then you say we need to correct nutrition. Now, everybody wants to help that patient. So, how do you help as a housewife, as a mother, as a sister, as a daughter, or as a husband? So, you have to give work to everybody. So, when you talk about using iron utensils, when you talk about eating healthy food, you are actually giving work to the entire family and you are shifting the locus of control from an external locus, doctor dependent or nutritionist dependent, to internal locus of control, which is family dependent. You're also changing the definition of internal locus of control from individual to family to teamwork. So this is actually a very good thing to do because you can get the entire family involved. So in our part of the country, we'll tell them, "Do you have iron utensils? You might have to, climb up into the attic to find one. You might have to ask your elderly aunts to gift you one." And then they'll say, "Yeah, I did get one in my dowry 30 years ago, and then I threw it away. So now I have to go and buy it again." One of my patients actually went to the market in Karnal searching for an iron kadhai, and the shopkeeper told her, "Tu bawli ho gayi hai. You must have become mad. Why are you searching for an iron utensil in modern 2022 when everybody else is asking for stainless steel?" But still, it
Correct.
is you can't guarantee. But from a biopsychosocial point of view, it does help improve overall health of the
And maybe,
family.
maybe, sir, the absorption, like we said, it may be just 3%, but every 1% counts, right? So it doesn't matter.
And it contributes to the health and nutrition of the family. Everybody does get involved.
Yeah.
Good evening for you from Dr. Yogesh Uplenchwar and also Dr. Monu Gurung. And Dr. Shashi Khannaji says, "Ma'am, you said that beetroot does not contain iron. That's strange. Can you please explain again?" And then it is a colored uh, dish, a colored vegetable. So, what other vitamins does it contain?
So beetroot has that bright purple red color. It is because of a pigment called as anthocyanin. So the anthocyanin gives you that wo beet wala purplish red color. It does not even have 0.1 milligram of iron. So please, so that what the rich source what beetroot has is two things. It is a very rich source of starch. इसीलिए there are countries who use beet sugar. They don't use cane sugar. They don't grow sugar cane. So they extract sugar out of beetroot and it is called as beet sugar. And second thing which beetroot is a very rich source is of nitrate. Beetroot is a very rich dietary source of nitrate, but it is definitely not a source of iron.
At all. And Mr. Basu points out that Halim is the Hindi name for garden cress seeds, and Aliv or Haliva, like you said, these are the Marathi names. Thank you from Dr. Vinay Desai. And Dr. Ramakant Sharma points out that he thanks you for clearing this misconception because virtually everybody says that beetroot is good, but you
Yes.
have to go deep. You have to find out why that color is coming, and you've mentioned it's a dye, anthocyanin.
सर बीट ग्रीन्स वो बीटरूट के ऊपर पत्ते होते हैं सो इफ यू आर गोइंग टू गेट इट फ्रॉम अ लोकल मार्केट विच इज कमिंग फ्रॉम अ फार्मर एंड इट्स नॉट वेरी क्लीन लाइक यू गेट इन सुपर मार्केट वो ऊपर जो ग्रीन पत्ते होते हैं दे आर वेरी वेरी रिच सोर्स ऑफ आयरन जो लोग फेंक देते हैं डस्टबिन में डाल देते हैं, तो उसको काट करके उसको पराठे में डालिए, उसको दाल में डालिए, तो यू विल गेट अ लॉट ऑफ आयरन.
That is very nice information. And ma'am, will the same hold true for radish greens as well? Because
Yes,
radish
radish
costs
greens are
about.
very rich source of iron. So, in fact, among all green leafy vegetable, poorest source is spinach.
Which we
स्पिनच से
think is the best. Yeah,
उससे
and
तो
we
धनिया में ज्यादा है. सो डोंट थ्रो अवे. कोई भी आपको रूट आप जो खाते हो, जैसे मूली है, बीट है, यूज द ग्रीन्स, एड इट टू योर नॉन स्पेसिफिक थिंग. रोटी में ऐड करोगे तो देर इज नो टेस्ट, राइट? यू आर स्टिल ईटिंग इट विद द सब्जी, सो यू आर गोइंग टू गेट
Mhm.
आयरन आउट ऑफ दैट.
So all these things which we tend to throw away or we tend to think are kind of inedible, they actually might be richer sources of iron. So radish greens, uh, very
And
easy
beet
and very
greens,
economical. It's something like 10 rupees a kg these days in North India.
right?
Dr. Sanjay Shihora thanks you for the wonderful lecture and asks, is soya bean a good source of protein? And
It
how can
is.
we eat it? Do's and don'ts for cooking soya bean at home.
So soybean, sir, is not only good source of protein, but it is a moderate source of iron as well. It's not a rich source, but it's a moderate source. So the only problem with soybean are two. If somebody who is eating it has thyroid, then we tend to tell them to avoid it. The reason is it has goitrogens. The other problem with soybean is lot of people can't digest it. And the reason is the skin of soybean has a trypsin inhibitor in it. So, because there is a trypsin inhibitor, it delays digestion of soya and thereby making soya very, very difficult to digest. So, people will tell you various things. They get constipation, they get flatus, they get other problems after eating soya. Takare aati hai. So, if they have to eat soya, they have to roast soya on a low flame. और जैसे मूंगफली के छिलके बाहर आ जाते हैं ना, सेकने के बाद when you rub the मूंगफली, the pink skin comes out. Exactly like that, if you roast soya and cool it, the soya का skin comes out. So the trypsin inhibitor is out. अब वो सोया को चक्की में दीजिए, आटा बनवाइए, and you can have it the way you like.
Another question, when we convert soybean to tofu, then are we able to get rid of the trypsin inhibitor?
We are. We are able to get rid of trypsin inhibitor, or goitrogen still remains.
So use it carefully, especially at breakfast time in patients with hypothyroidism. But
Correct.
otherwise, we are good to go. And
And
even
also
those
don't eat raw. If soya be tofu bhi aap sek karke, like like we eat paneer, we put it in a boiling gravy or something like that, then it's all gone. But if you're going to eat it kacha, then it's a problem.
and avoid it at breakfast if your patient is taking thyroxine because it will also reduce the absorption of thyroxine.
Yes.
But for lunch and dinner in moderate quantities, it's fine. One more very important question from Dr. Ramakant Sharma. Role of jaggery in iron health.
Yeah, I was waiting for this question. So traditionally, sir, jaggery was made कि वो गन्ने का जो रस रहता था, they would put it in a लोहे की कढ़ाई and they would cook it. And exactly like we discussed, वो कढ़ाई में का iron would go into jaggery, and hence if you gave jaggery in a lab to find out the nutritive value, it would come very high in iron. अब जो जैगरी बनती है वो फैक्ट्री में बनती है, जो कास्ट आयरन में नहीं बनती. It is just made in like any kind of like a boiler, which is made up of stainless steel, and therefore now jaggery is not a rich source of iron.
Yeah,
And
unless you happen to be from Haryana or Western UP and then you're getting it made in the village. It's home
ha,
cooked jaggery. Then it will
then
be in
it's a
that old
different thing.
fashioned cast iron.
Yeah.
More questions and greetings to you from Dr. Manu Sharma, who is a physician in South Delhi. Also from Dr. Sanjeev Puri, who is a physician in Hoshiarpur in Punjab. Dr. Sanjeev Puri has two questions. He says, ma'am, amle ka achar, that is amla pickle, ये तो boil करके बनता है. You have to boil it. So does it mean that we should not be encouraging our patients to take amla pickle?
So if you're giving avle ka achar as a source of vitamin C, no. Because also remember in achar you add namak. बिना नमक के तो अचार नहीं बनता. and sodium is a potent oxidizing agent, and आंवले का vitamin C is a reducing agent, so it's going to oxidize the reducing agent and make it useless. And therefore अगर जो आपको आंवला for medicinal benefit खाना है तो आंवला खाना पड़ेगा, टेस्ट के लिए खाना है तो आंवले का अचार खाना पड़ेगा. So you have to choose. You can have both. You can have थोड़ा सा अचार and रोज एक आंवला.
Yeah. So I think when we speak with our patients, we should talk about raw amla for nutrition. And otherwise, as part of diet, of course, there are so many things that are eaten. So, I mean, everything is fine, whatever they feel is tasty. Another question from Dr. Sanjeev Puri. Uh, Calcium tablet, we are so confused. Do we take it with food, without food, at breakfast, at dinner? So, what do you tell your patients in your clinic? So that Dr. Puri and I, we can do the same.
So I typically tell people to take iron at night and calcium somewhere in the afternoon. Night only because after taking iron, most of the patients are very nauseous most of the time. तो फुल स्टमक पे आयन लेके वो सो जाते हैं तो वो जो वट एवर परसेप्शन ऑफ नोजिया वगैरह वगैरह है दैट बिकम्स लेस. कैल्शियम आई टेल देम टू टेक ड्यूरिंग द डे.
And if patient is on both iron and calcium
इसीलिए then I
supplement,
separated by couple of hours, right?
yeah,
One at night, iron definitely at night, because breakfast ke baad if you tell them to take iron, which is typically told, then they are very nauseous to eat a lunch, so that they don't tend to eat an egg meal after that, and then the whole purpose of giving iron is lost, because then they don't have other nutrients, they just have iron in their diet.
so you've already answered Dr. Nitin Narula's questions, which was you just increase the nuts and the seeds to give that thermogenic feeling in winter. So other things which I use in my OPD, that is cinnamon, dalchini. So we encourage our patients to take more cinnamon as a spice in their milk and in their tea. And Dr. Nitin, I think a cup of hot tea or hot milk, that would be one of the best things to help reduce the sensitivity to cold weather. It should be hot cocoa. So it depends upon your patient's background, how much they're willing to experiment in the kitchen, but any hot beverage.
Haldi wala doodh is a good idea.
Haldi wala doodh is all-time favorite from Haryana. So if you know the joke, Shilpa ji, so when you talk to Alexa in Mumbai, so if you ask Alexa to, tell you 10 different things, you will get 10 different answers. But here in Haryana, if we ask Alexa for a treatment for anything, the answer is just haldi wala doodh. It actually works. It does work. But turmeric can also be toxic. So don't go overboard with that as well.
So, sir, I know I'm going a little off track, but again, I don't know if you get it in North India, but at this time of the year, in western part of India, you get fresh haldi. So
Yeah,
it
it
is
got
a root
printed
like
there.
ginger,
Yes, we use that.
correct? So that
Yep.
is really, really good if you want to avail the benefits of curcumin really well. That's a very, very good form of eating haldi. So there are two kinds. One is orange in color, and there is one more haldi which is called as amba haldi,
Yep.
which is
That
cream in color, smells like a mango, but it's a turmeric, and that's also very, very good for as an antioxidant. So these have really high amount of curcumin in them, and one can use them as an antioxidant in the diet.
both are available here. Amba haldi comes from Himachal, from the hills, and it is an integral part of diet. Though in the OPD, I do struggle when I'm speaking to younger ladies, and of course to younger men. Then we struggle to explain to them what this is and how to use it. But otherwise, if it's a middle-aged or elderly lady or gentleman, then things move very smoothly in the clinic.
Correct.
And thank you for reinforcing this. So you would have suddenly, Shilpa ji, you've got lots of more admirers now. And we thought that haldi is just old wives' tale or something, and now you're adding modern wisdom
No,
to it.
no, this is like I in my diet sheet till May. I tell them buy it enough in February and freeze it and eat it till May at least, and then you start getting it again in November. So we have a lean period of about 4 months where we don't have it, but otherwise I continuously advise it.
Dr. Sanjeev Puri asks if I can fry the tofu. थोड़ा सा fry कर सकता हूँ क्या? Is
हाँ
that
हाँ
fine?
फ्राई कर सकते हैं सर, कम तेल में कीजिए, बस यही है क्या.
And Shashi Khanna ji ka question tha about beetroot. Is it good for heart patients? But let us expand upon that question. Heart patients without diabetes, heart patients with diabetes. The question is beetroot.
So, because it has nitrate, it will actually help your blood vessels to expand. So, it's a good thing. But again, like Sir said, if it is with diabetes or with hypertriglyceridemia, then you will find moment people will start increasing their consumption of beet, their postprandial sugars and triglycerides will start going up. सो बीट का जूस तो बिल्कुल भी मत दीजिए बिकॉज जूस दोगे तो ऑन अ सीजीएमएस यू विल सी लाइक अ माउंट एवरेस्ट वाला पीक यू नो लाइक टॉल पीक so no juice if at all you want to give them give one or two slices in a form of salad among many things so gajar bhi hai खीरा भी है टमाटर भी है और दो टुकड़े बीट भी है something like that then it's okay but if they do not have diabetes then you can give them but again don't give it as juice give it as like slices of food to eat.
Dr. Bharti points out that in hotels you get ABC juice, which is apple, beetroot, and cucumber,
Carrot. Ah.
carrot. So does that work or no?
So, sir, like you know, nowadays all dietary principles, whether we are talking for diabetes or general health, strictly advise no juicing. So we when patients say we take ABC, we tell them you eat an apple, you eat a carrot, and you eat a beet, and don't mix them and don't juice them. Because वो एक ग्लास जूस बनने के लिए सब कुछ दो दो लेना पड़ता है दो सेब दो गाजर दो बीट and the calories become 200 and we don't want that.
Khajur or dates? So this question is from Dr. Sanjay Shehora. Khajur or dates as a source of iron?
They are very rich source of iron, very very rich source of iron. वो सूखे डेट्स छुआरे
Hmm.
they are even more richer because they are dehydrated. So when you dehydrate, the iron stays back. So these are rich sources of iron. If somebody does not have diabetes, again the problem comes with diabetes because dates are a very good treatment for hypoglycemia. If somebody is having low blood sugar, date खाते ही एकदम फटाफट फटाफट sugar ऊपर आ जाती है. So if they have diabetes, you can't give them. But if they don't have diabetes, include dates in the diets of person who has anemia, and you will see a lot of difference. If they don't want like dates and if they like chuare, you can even include that in the diet, and it will help.
One question from Dr. Mahinder Sharma. He says you had spoken about radish greens. So other vegetables that we use, like cabbage, for example, is cabbage a good source of iron and or protein?
No, neither. So cabbage is not a rich. So I mean, I'm not saying it doesn't have iron like beet. It has, but very little. It doesn't have protein for sure. So cabbage doesn't have protein. It iron is also very less. But use other like sarso will have iron. Bathua will have iron. These kind of vegetables will have a lot of iron. So try to use these locally grown, very traditional kind of foods will have a lot of iron.
And I think radish greens is something that we all take home today, and we will begin practicing from tomorrow morning. We won't throw it away anymore.
Because if you feed it to your cattle will get all the iron. I mean they need iron as well, but you also need it as much.
Dr. Sanjeev Puri says that traditionally we are taught that fish and curd or fish and milk cannot be taken together. Is there any scientific principle behind this?
So again, sir, this is very regional. So for example, in north or across other parts of India, we don't have non-veg and curd or milk together because it's a Ayurvedic principle. But you go to east of India, dahi mach, fish made in curd is a traditional Bengali recipe eaten by them for whatever 5, 6, 700 years since that recipe is created, and there is no problem. Dahi mach is one of the most liked or one of the it's chole bhature of East. It's like ubiquitous. So I am really not sure. We do not have data to show any of that. And also in the Western world, so if you look at what is kosher, so there is a Jewish concept of kosher. Some food is kosher and some food is not kosher. Kosher does not permit dairy and meat to be eaten together. So even this is a principle in kosher food. But other than that, we really don't have data to show it. But for example, I come from West in Bombay. If there is fish made, there is no curd or milk served in that meal. That मतलब रायता नहीं देंगे, मिठाई विच इज लाइक श्रीखंड नहीं देंगे, आइसक्रीम नहीं देंगे वो मील के बाद खाने, बिकॉज इट हैड fish in it. But otherwise, other parts of the world, you eat everything. So fish and cheese is eaten together, for example. And so we don't know.
Ayurveda is very rich in wisdom, but we must understand not only textual but contextually how it was created. Just remember, at that time they did not have electricity, they did not have refrigerators. So when you are told not to eat after sunset, one of the reasons is because there is no electricity at home. And if you are going to cook with the help of a candle, with candlelight, you will get in trouble. Also, if they tell you don't eat food which was prepared a day before or 12 hours before, that is because there was no electricity, no way of preserving it. So keep those things in mind when you're assessing uh, any ancient text. One question allow me to take. This is on diabetes from Dr. Vinay Desai. So if the patient is 51 kg, 50 units per insulin is fine, and you've already reached there, but we don't have good control. Appetite is good, that's a nice thing. In this particular patient, we have to increase the dose of basal insulin from 20 to 24 or 28. We can also change the preparation. Instead of NPH or glargine, you can shift to glargine U300 or degludec, which are ultra long acting insulins. Once you've done that, you can also try to reduce the dose of rapid acting from 10-10-10 to maybe 8-8-8. Because what you see is that fasting is 360 and before dinner is also 370. So it hasn't risen all that much. So you can tell your patient, I'm increasing the basal insulin. I am changing the preparation to give an ultra long acting one. If appetite is good, you can always add metformin 500 milligram twice a day or any other sensitizer. So with this, Shilpa ji, we've come to the end of these exhaustive questions. I acknowledge all the other questions that have come on weight loss and polycystic ovary syndrome, but allow us to keep that for another day. And Shilpa ji had recently been with us on KK Med Talks. I think this was Monday. It was
Yes.
Thursday. Yeah,
Thursday.
Thursday, just 3 days ago. Please log into that and listen to her insights, very revealing insights about how to lose weight. Another question from Dr. Aditya Vardhan. Let me take this before we go. This is sacubitril valsartan versus DAPA or EMPA. So we can actually take both together. DAPA or EMPA will help you in glucose control and also in preventing and managing heart failure. The checklist for DAPA or EMPA is shorter as compared to the checklist for sacubitril valsartan. Sacubitril valsartan will help you in heart failure, but there is a risk of electrolyte disturbance. And if you are already giving your patient ACE inhibitor or ARB, you will have to stop that before you start this. So don't think of comparison. You can give them both together. Now, the next question that Dr. Aditya will ask is, can I give simultaneously or sequentially? So if your patient is very sick, heart failure is of great severity, you can give simultaneously. If your patient is able to come back a week later, if you can monitor sodium potassium regularly, you're not worried about hypotension, then again, give simultaneously. If, however, your patient cannot be in close touch with you for regular follow-up, you are worried about dyslipidemia, uh, the severity of heart failure is not so much, or the severity of diabetes is not so much, patient is relatively stable, then we can go sequentially. Which one would you start first? In a patient with diabetes, if there is no contraindication, start the DAPA or EMPA. If the patient is non-diabetic, you start sacubitril valsartan. So it's just about sequential versus simultaneous. Finally, we should be giving both for ideal management of heart failure. With this, Shilpa ji, we've come to the end of today's talk, and I'd like to thank you once again. We were speaking of Ayurveda, so I'm reminded of this discussion that is written in the Charak Samhita. And here, this Punarvashu, convenes a debate about health, about disease. So the learned sages begin talking about the pathogenesis of disease in general. And there is so much of discussion that Punarvasu says it is just like, you're running after your own tail. The analogy he uses of an oil presser. So the oil presser is going round and round, but finally there's no conclusion. The speed is there. There is a lot of debate amongst the learned doctors. The velocity is zero. So what Atreya says is, let me suggest a unifying concept. That is that good food will give you growth, good health, and bad food, unwholesome food, will give you ill health. It's as simple as that. Then he begins talking about dietetics. But then another doctor called Agnivesh, he stands up and says, and this is from the Sutrasthan in Charak Samhita. He says that you've told us so many complex things, I don't think any doctor can understand. And then the answer is from Lord Atreya, you need to know the basics of nutrition. If you know the basics of nutrition, then you will understand. So, this message for everybody who is logged in today, we are lucky to have our modern Lord Atreya, Shilpa Joshi ji. Thank you for
Really,
having
sir.
explained the basics of nutrition to us. And to Shilpa Joshi, thank you. I am very sure Punarvashu and Lord Atreya and Agnivesh, wherever they are today, they will be watching over us. They will be very happy that you have come on Diabetes Essentials and you have helped us with this iron talks. Thank you so much,
Thank
madam.
you, sir. Thank you. Thank you.
Mr.
Thank you.
Basu is with us. He is our iron man behind the scenes.
Ma'am, I
And
think this was
Agnivesh
one of
and Treya will thank you as well, Mr. Basu, for facilitating the debate.
yes, sir. I was about to say the same thing because a lot of misconceptions and myths have been broken today about the diet, especially for anemic contents. So, ma'am, no words to say thank you to you, and continue to come with such knowledges, especially from the nutrition aspects, because we a lot of time discuss on the pharmacotherapies, and we most of the time that is been also been missed in our sessions. But being today, you in the session has completed the circle of pharmacotherapy as well as the nutrition in aspect, ma'am. Thank you very much with us. At the same time, I thank Dr. Sanjay Kalra because he is so busy. And morning he was there in Ames Batinda, and evening he's taking the session. Thank you very much, sir.
Thank you for the opportunity and thanks to everybody who is logged in on a Sunday evening. Jai Hind.
Thank you so
Thank
much. Thank you.